Hello friends, welcome to Technical Modern Pharmacy. In this channel we discuss about pharmacy related job and vacancies and interview related data. So today we are going to discuss about frequently asked questions in the interview of pharmacovigilance. So let's start discussion. First question is, what is pharmacovigilance? This question is widely asked in all the interviews. This is very important question. Please learn the definition. Definition is pharmacovigilance is the science of collecting, detecting, assessing, monitoring, researching and evaluating information from healthcare providers and patients on the adverse effects of medications, biological products, herbalism and traditional medicine. This is the definition of pharmacovigilance. Mostly interview of pharmacovigilance starts with this definition, so please learn it very well. Second question, what are types of pharmacovigilance? So the answer is there are two types of pharmacovigilance, one active PV and second passive PV. Active PV is safety surveillance, means that actively measures that taken to detect adverse event. This is managed by active follow-up after treatment, and the events may be detected by asking patients directly or screening patients record. The most comprehensive method is cohort event monitoring method. And about passive PV, passive surveillance means that no active measures are taken to look for adverse events other than the encouragement of health professionals and other report safety concerns. Reporting is depend on the initiative and motivation of the potential reporters. This is most common form of PV and known as spontaneous or voluntary reporting. Third question is, what is basic criteria required for valid case? The reports which we received are called as ICSRs, means individual case safety report. All those are cases, and those cases need basic criteria to be a valid case. So those basic criteria are mentioned here. Those are four. There should be an identifiable patient, there should be an identifiable reporter, there should be an adverse drug event and a suspect product. So we will discuss about all these four parameters one by one. Start with identifiable patient. So question is, please brief about identifiable patient. Interviewer may ask this question in different ways. So just keep in mind what is identifiable patient. One or more of the following should be automatically qualify a patient as identifiable, with that is age or age category, adult, elderly, and other than age, gender, initials, date of birth, name or identification number. If any of these information is reported, it means the patient is reported and case becomes valid. Means patient validity is fulfilling here. We don't need all the details of the patient. We just need at least few information which will indicate that there is some patient who has taken the medication and adverse event occurred. For example, I have mentioned here, we receive many literature reports which which have multiple patients, and the report says the patients, plural, the patients experienced XYZ drug. In this scenario, the patient is not identifiable, so the report will be invalid. If the report will say that a male patient experienced, then there is identity of a male patient, that report will be valid. But if there is no any identity, we cannot consider it as valid patient and the case will turn to invalid or non-valid. So the second validity criteria is identifiable reporter. Let's see. The identifiable reporter is same as identity of the patient which we saw in previous slide. The answer is following one or more criteria qualify to consider reporter as identifiable. Initials, name of person or relationship with the patient, for example parents, or name of any institution from where adverse event is being reported, complete mail address or professional qualification like MD or doctor. Reporter occupation, address, phone number, fax number, email address, any of these information must be reported. Then only we can consider that sender is a identifiable reporter. Otherwise, we cannot consider a valid report. Question number 6. Who can be a spontaneous reporter? Or who can report adverse drug reaction or adverse event spontaneously? Question might be asked in different ways. So keep in mind who can report the adverse events. So, and the answer is physician, pharmacist, nurse, medical staff, patient, relative of patient or any individual can report adverse drug event or adverse event. Question number 7. When do we consider a case to be medically confirmed? There are two types of cases. One is medically confirmed and another is medically not confirmed. So the answer is the case is considered to be medically confirmed if at least one event is reported as medically confirmed or case is reported by HCP, healthcare professional. The healthcare professional can be a physician, nurse, pharmacist or any other who is in health department. So we discussed about the reporter details, reporter identity, and we receive these ICSR from different sources. So I have put this slide here to understand the sources from where we are receiving these cases. So understand this slide. This is very important slide. Please learn it. This is very helpful. It will help you while answering the interview. This slide will help you while processing the cases and many other places it will help you. So the sources of ICSR I have mentioned here. There are basically two types, two categories, solicited and unsolicited. We will see first solicited. In solicited, there are four types I mentioned here. First is clinical trial, second survey of patient, third disease management program, and fourth post-approval named patient use program. We will see other side, that is unsolicited source. So there are also I mentioned four types. First spontaneous, second regulatory, third internet or social media, and fourth literature. We can correlate this slide with previous slide where we saw active PV and passive PV. So we can consider this active PV and this passive PV. Solicited is active PV and unsolicited is passive PV. In passive PV, there is spontaneous report, regulatory report, and reports from social media and literature articles. But in active PV means solicited, reports, adverse events are being collected proactively. Clinical trials are being conducted with well designed protocol. Survey is proactive activity. Disease management program, name itself indicating it is a program. So this slide is very important. Please learn it. It will help you a lot. Moving to next question. Next parameter is adverse drug reaction. Next validity criteria is adverse drug reaction. So understand what is adverse drug reaction, what is adverse drug event. The answer is any untoward medical occurrence in patient or clinical investigation subject administered a pharmaceutical product and which does not necessarily have a causal relationship with this treatment. Any patient or clinical investigation subject. Patient means any patient, but clinical investigation subject means this is a part of any study. Any of those taking any medicament, any drug, and any adverse event is occurring, but that adverse event has no causal relationship with this treatment, that is adverse drug event. Now we will see what is adverse drug reaction. This is approx similar words with very narrow partition, adverse event and adverse drug reaction. So the answer is adverse drug reaction is response to a drug which is noxious and unintended and which occurs at dose normally used in man for prophylaxis, diagnosis or therapy of the disease. There is a causal link between drug and adverse drug reaction. In short, adverse drug reaction harm directly caused by the drug at normal dose during normal use. We will see difference between adverse drug reaction and adverse event in next slide. So the question is here, what is the difference between adverse event and adverse drug reaction? Both these words are very common in PV interviews. So please be careful about all this. There is very narrow partition between these two words. So the answer is, there is a causal link between a drug and adverse drug reaction. This is ADR. There is there is a causal link between drug and adverse reaction, is ADR, and there may not be causal relationship between drug and ADE, that is adverse event. Very simple to understand. Moving to next question. When do we consider an event to be serious? The question is, when do we consider an event to be serious? So the answer is, if an event is associated with any of the following, it is considered to be serious. Basically, there are two types of events reported in ICSRs: serious events and non-serious events. So when the event will be considered as serious? So the answer is, if related with any of these listed seriousness criteria, then event is serious. Death is obviously serious. Life threatening is also serious. If patient gets hospitalization after taking drug, event becomes serious. If congenital anomaly, event becomes serious. Disability, event becomes serious. And medically significant, this is also serious event we will consider if reported. If none of these reported, then we can consider as non-serious. Moving to next question. What do you mean by causality? Causality is nothing but relationship between adverse event and the suspect product which patient has taken. Relationship between event and drug is causality. We will see the words. In pharmacovigilance, causality is the relationship between suspect product and adverse drug event. We will see next criteria of validity of ICSR, that is suspect drug. What is drug? This is the very simple question we have studied in first year. Any substance that is used for diagnosis, treatment, prevention of disease or disorder in human or animals is a drug. But what is suspect drug? The answer is, a suspect drug is the drug associated with the ADR as determined by the initial reporter. A suspect drug is the drug associated with ADR as determined by the initial reporter. Means initial reporter has reported that my patient or any patient has experienced adverse drug reaction after taking the suspect drug, after taking XYZ drug. So that drug is called suspect drug. Next question. What is WHODD? The abbreviation of WHODD is World Health Organization Drug Dictionary. We can code drugs other than company suspect drugs using WHODD. So what we can code? We can code co-suspect drugs, means patient is taking other suspect drugs than other drugs than suspect drug. Historical drugs, in past patient might have taken few drugs, those also can be coded with the help of WHODD. And concomitant drug means patient might be taking any other drugs along with suspect drug, so those drugs called as concomitant drugs. So friends, we have discussed few 15 or 16 questions which are frequently asked in the interview of pharmacovigilance. So I try to minimize the video with minimum content. I will post next video and I will try to cover remaining part, but these 16 questions are very commonly asked in the interview. So I'll keep posting job vacancies, and same time we'll provide few common question and answer for the interviews. So please like, comment if there is anything missing or needed to update, and share this video with your friends who are trying to crack the interview but getting fail, or they don't have any idea about PV interview, share with them and subscribe the channel. You can follow me on LinkedIn. I have provided link below. Thank you for watching the video. Have a nice day.